So you say you're doing less and less bone grafting.
Yeah. I mean, if for dental implants now, we would do maybe 10% of cases where we need to do a bone graft. So it's been the advent of technology that's allowed that to happen. So the implant surfaces have improved, where it used to be half of the implant would bond to the bone. Now something like 70 or 80% of the implant bonds to the bone. So that means we can get away with a shorter implant. And otherwise as well, there's techniques that have changed. So we used to have to say do an implant in the upper back here. There's a sinus, and so right up here is an empty space and it's air. So you can't just put an implant there. But there's a technique for bending under the sinus. We used to actually open the sinus up, pack bone in there, and even to this day, there's probably still people that have been told they need to, take bone from the hip, put it in the sinus, and then wait 6 or 8 months and then do an implant. That just doesn't happen anymore. We just, again, we're working on a paper with UBC that's been submitted on osteotome procedures. So we now can work.
So you're doing a paper?
Well, it's actually done. It's been submitted.
Okay.
926 of these that we followed out to 10 years now. And we were going down as low as 2 millimeters of bone. Now the conventional height is 5 for doing this bump up technique called osteotome, where we bump under the sinus. So instead of actually putting bone in first, we use the membrane flexibility to kind of stretch up, and the bone packs in ahead of the implant. So we're not actually even doing bone graft. We don't have to buy any extra product. It's not any additional delay. It takes anywhere from 2 to 3 months for the bone to heal, which is the normal healing time for an implant.
Is there a lot of bone grafting that is going on?
Yeah.
That doesn't have to be?
Probably. And
in the hands of maybe less experienced?
And socket grafts, that's another topic, right?
I've never heard of
talking about that. Well, basically you take a tooth out, you fill it up with some bone, and then you wait to do the implant later. But the problem is, what do you put in there that's going to be bone? The only thing that's going to form bone for real is a blood clot, and then your own bone cells migrate in. So everything else is kind of a filler that might initiate or complement the bone, but the reality is it kind of acts like a foreign object.
You told me on the phone, some people go to you specifically because they're trying to avoid bone grafts.
We had a case.
Is that right?
Yeah,
How do they hear? Who tells them this?
Usually it's a patient that we've seen that they were talking about, so they might, like say that you find out you've been told you need an implant and you're going to have to get the tooth extracted and then pack the socket or maybe graft the sinus, and then you'll meet a patient that we've done work on 5 or 10 years ago and said, well, Dr. French didn't do it that way, how come I can't do it? So then they end up calling us. Like this one gal we saw, she was referred to us for a second opinion from a friend, and she was given an estimate of about $2,000 for sedation and socket grafting, both of which are, weren't really needed because she wasn't really nervous. We were able to do the implant without any bone grafting in the socket, and at the end of the day it saves her a couple $1,000, and it's also—
And a lot of pain as well, right?
And maybe not so much the pain, but it's more predictable. We know for sure from studies that bone grafting increases complication rate. It does.
Interesting.
We want a bone graft, yes, we do, when we need to. So like if we absolutely don't have bone, then we bone graft. But we don't necessarily bone graft and to try and, maintain bone necessarily.
And this is a new way of thinking.
Well, it's kind of controversial even, because there's still a big trend out there to socket graft and or to do these, large grafts for big implants. So I'd say that the marketplace is moving, or the trend in the science is moving to more conservative, less invasive procedures, but there's still a large cohort out there that is doing conventional, grafting procedures.